Bismillah ar-Rahman ar-Rahim. These questions come from Dr. Yumna. What are the differences between the three bags? The TB's resuscitator and the flow inflating bag and self-inflating bag. Put in your mind the main difference points. It will be both will give oxygenation and ventilation. Oxygenation and ventilations. In the TB's or the neopuff and the flow inflating bag, it will give oxygen. What we need from oxygen? I need oxygen. It will be blended and adjustable. I can adjust this oxygen. So it will give me oxygen from 21 up to 100%. So the TB's or the neopuff and the flow inflating bag, it can give me from 21 to 100% oxygen. But the self-inflating bag, actually, he will give me only 40% oxygen unless you connect to oxygen reservoir, whatever open or closed oxygen reservoir, to give me more than 90% to 100% oxygen. So this is the most important point, the oxygenation. So the oxygenations, I need oxygen blended and adjustable. When I use it, I use to, for example, if the baby more than 35 weeks, I have to initiate the resuscitation with 21% oxygen, because the survival rate, it will be better and outcome it will be better with 21% oxygen. If the baby less than 35 weeks, I have to start it with 21 to 30% oxygen. When I give 100% oxygen, if this chest compression is indicated, if there is chest compression is indicated, I have to increase the oxygen to 100%. So I need a device can give me 21 and 30 and 100%. But the self-inflating bag, it will give 40% oxygen unless you connect it to oxygen reservoir to give you more than 90% to 100% oxygen. This is the most important point for differentiation. The second point, we finish the oxygenation, we'll go for ventilation. Ventilation, we need pressure and volume. Pressure and volume. The most important part here, if you will see here, this is the TB's or the neopuff. It will be the pressure. So the pressure, all will give me pressure. But who will give me pressure without harm? The benefit without harm. صدقة لا يتبعها أذى. It's okay. All will give me pressure, but inconstant pressure, uncontrollable. Is not distant pressure, is not persistent pressure. But the neopuff or the TB's, it will give you controllable, it will be consistent, constant, persistent pressure. What is the benefit from all of this? Because actually, if you will give PEEP, it will improve the function residual capacity and will keep the lung open, so prevent atelectic trauma. Also, constant pressure or controllable pressure. Even the TB's or the neopuff will adjust the pressure before you start the resuscitation, so it will prevent the barotrauma. So the constant pressure, controllable pressure, it will prevent the barotrauma, atelectic trauma, and the shearing injuries, the swinging in the pressure leading to shearing injuries and leading to biotrauma or inflammatory process. So it will prevent the barotrauma, atelectic trauma, biotrauma, even volutrauma. It will prevent all this trauma. It will prevent even the volutrauma. So the ventilation, it will be pressure and volume. Pressure and volume. So the pressure, all will give me pressure, all will give me benefit, but maybe will give me harm. What is the harm? It will give me pressure, but not controllable, not consistent, inconsistent pressure. Why? It lead to barotrauma and atelectic trauma and biotrauma. But the neopuff and the TB's, it will give me constant, consistent, distant pressure and persistent pressure. This is the beauty of the neopuff and the TB's. عشان كده بيسموه هو ده عمهم، هو ده الكبير بتاعهم. All in one, all in one. It will be all in one. The second issues in the ventilation, pressure and volume, all will give unknown tidal volume. All will give unknown tidal volume. So we'll go one by one. We'll see here. The first differential point, provide CPAP. For example, I have premature babies, heart rate more than 100, and his breathing spontaneously, but the problem with the breathing is labored breathing, difficultly breathing. So I have to give CPAP. I have to give him CPAP. All will give CPAP except the self-inflating. All the TB's or the neopuff and the flow inflating bag, it will provide CPAP. Self-inflating will not provide CPAP unless using the PEEP valve. You have to use PEEP valve. الحته الحمراء اللي فوق, the red part in the self-inflating bag, it will help to provide CPAP. So all will give or provide CPAP except self-inflating bag unless you using the PEEP valve. This is the first differential point. The second differential point regarding to require gas source. All require gas source except self-inflating bag. No gas source required because it will refill spontaneously. The third differential point, and this is the most important differential point. The most important. This is controllable, consistent, resistant, and adjustable pressure. The pressure, the PEEP and PEEP. Peak inspiratory pressure and positive end expiratory pressure. PEEP, I need it to improve the functional residual capacity and keep the lung open or the alveoli open, so prevent atelectic trauma, and it's constant. And also I need PEEP. PEEP is constant also. So it will prevent from swinging in the pressure leading to shearing injuries and barotrauma. So the controllable and constant standing pressure, it will help to prevent the barotrauma. The other, if you will see here, the flow inflating bag and self-inflating bag, inconsistent pressure. So it will give me pressure, but he will give me benefit, but it can harm. It will give benefit, but there is harm from barotrauma, atelectic trauma, biotrauma. So صدقة يتبعها أذى. But neopuff or the TBs, he will give me the benefit without harm. The fourth point is the oxygen. So the oxygen we mentioned before, the oxygen I need blended oxygen, adjustable oxygen, give me 21 up to 100. So the TBs or the neopuff and the flow inflating bag, it will give you from 21 to 100%. The self-inflating, it will give you 40% oxygen, unless you put the oxygen blend, oxygen reservoir, it will give you above 90 to 100%. At the last point, it will be unknown tidal volume. All will give unknown tidal volume. So the differential point between the TBs and the flow inflating bag and the self-inflating bag, all will provide CPAP except the self-inflating, unless you put the PEEP valve. All require gas source except self-inflating bag because it will refill spontaneously. All will give inconsistent, uncontrollable pressure except the TBs or the neopuff, it will give me constant pressure. All will give me 100% oxygen except self-inflating bag, unless you put the oxygen reservoir, whatever open one or closed one, to give me more than 90% to 100%. All will be unknown tidal volume. But put in your mind, the most important differential point, it will be the pressure. The pressure in the neopuff or the TBs, it will be controllable, consistent, constant, descending pressure. Why? To prevent the injury or the lung injury, the barotrauma and atelectic trauma, biotrauma, and even volutrauma. It will prevent all of this. If you will see here, this is the equipment we needed. If you will go systematic approach, the first initial steps, then provide warm. So I have to provide the warm. I have to be the warm is there. The second, also to clear the airway, so I have to look for the bulb syringe here. The bulb syringe, this is the blue one. Then I clear the airway, then after that I dry, stimulate, then I reposition the patient, then I assess him heart rate and oxygenation. Then I will see if this patient needs post pressure ventilation or needs CPAP. So I have to be the self-inflating bag or whatever the flow bag or the neopuff, it will be the best. It will be available. Then after post pressure ventilations, if the baby is not improved, I have to do Mr. Soba. If the baby is not improved, should I prepare for the alternative airway like the intubation, so the laryngoscope and the tube, it will be there. Then after that I will see if the baby maybe is not improving and needs some medication, so the medication, it will be available. All will be available. If we see here, didn't use it if no PEEP valve. Where is the PEEP valve? Here, this is the PEEP valve. This is the PEEP. الحتة الحمراء دي, this is the red area. This is the PEEP valve. What is the benefit from this PEEP valve? It will keep the lung open It will improve the function residual capacity and will keep the alveoli open during the expiration or passive expirations, so it will prevent atelectatic trauma. So don't use it if no PEEP valve. What's the benefit of the PEEP valve? It will keep the alveoli open during the expiration, so it will prevent atelectatic trauma. Also here we need pressure manometer. Why we need pressure manometer? Because the pressure inconsistent, uncontrollable. So to monitor your pressure, to prevent the harm. It will give you benefit, but maybe you will harm the patient and will affect your outcome. After that, it will affect your quality indicators in your unit. It will affect your quality indicator or key performance indicator in your unit. So pressure manometer to monitor your pressure, what you are give, to prevent the harm for the baby. If we'll see here, this is the magic. Rate, it will give rate, the physiological rate, 40 to 60 breath per minute, and less tidal volume and visual pressure, it will give you better outcome. This is, call it high frequency actually. If we'll give high rate with low tidal volume, less than the dead space, with controllable or distant pressure, it will be better outcome. This is what we need. Because actually the neopuff, it will give you constant distended pressure, and this is the most important one, and will give the physiological rate. It will give the physiological rate 40 to 60, and this, the beauty of the neopuff, it will be better outcome to prevent the chronic lung disease or decrease the incidence of chronic lung disease. We need high rate, small tidal volume, controllable pressure or distant pressure, so it will improve the outcome. This is a pressure manometer for non-bracing. This is a pressure manometer. What would the benefit from it? Actually, we needed to control the pressure, to monitor your pressure, how much you give. Otherwise, inconstant pressure may harm the patient. You give pressure, but we don't know how much is this pressure, so you have to monitor this pressure, how much pressure you give. We need initially is 30 to 40%, then maybe this patient need only 20 or 25%. You can initiate with 20 to 25% millimeter or centimeter water to not harm this patient. In the sick lung or stiff lung, maybe you need 30 to 40 centimeter water. In the normal lung or good lung, just only maybe you need only 20 to 25 centimeter water. So you have to monitor this pressure. Actually, the neopuff is better in this. It will give you controllable, consistent, constant, persistent pressure, so it will give the benefit and prevent the harm. صدقة لا يتبعها أثم. This is a PEEP valve, you see, very magic. This is a PEEP valve. You can use it in the self-inflating bag just to control or to keep the lung open or the alveoli open during the expiration, so it will prevent the atelectatic trauma. And here you can adjust the PEEP, how much the PEEP give. You can start from 5 and maximum it will be 8. From 5 to 8 centimeter water. This is the range. This is the minimum range. It will be 5 and maximum it will be 8. Here, this is the PEEP valve. This is the red one. This is الأحمر. This is the PEEP valve, and very important to prevent the atelectatic trauma and to keep the lung open and improve the function residual capacity to prevent the atelectatic trauma. And bob off valve also is very important. Here, this also we need the PEEP valve and we need the bob off valve. All this will be very important actually. Here also, if you see the PEEP, we need the PEEP valve down here. The PEEP also need the PEEP valve here to prevent the atelectatic trauma. Here, the most important part. This is the magic. The neopuff or the call it the TBs. ده عمهم كلهم. بيقول لك عمهم كلهم. كله منه فيه. All in one. We'll take the benefit first of all. CPAP. So the neopuff, it will give you CPAP. If you have premature baby having heart rate more than 100 beat per minute, and the baby having spontaneous breath, but the breathing is labored breath or difficult breath, you have to start the CPAP. It will give you the CPAP. This is the most important benefit. And also the flow inflating bag, it can give you CPAP, but the self-inflating, it will not give you CPAP unless you bought the PEEP valve. So this is the magic of the neopuff or the TBs. It will give you CPAP. The second one, the pressure. You see the pressure limited ventilation. Pressure limited. Why pressure limited? Controllable and constant and persistent and distant pressure. So prevent what? Prevent the barotrauma. Prevent the barotrauma. So prevent barotrauma. So it will give you benefit without harm. The other, the flow inflating or self-inflating in constant pressure. We don't know what is the pressure you give unless you look for the manometer and you adjust the pressure you give. So it will help you to prevent the harm the patients and prevent the barotrauma. Also, you see, with PEEP, also the PEEP, so it will keep the alveoli open during the expiration, so to prevent the atelectatic and improve the function residual capacity. And even the beauty of this CPAP, it will preserve the surfactant of the patient. This is one of the beauty. This is one of the beauty of the CPAP, to preserve the endogenous surfactant. Preserve the endogenous surfactant. What is the third benefit? The blended oxygen. You see, blended oxygen. Blended oxygen is adjustable. I can give 21, I give 30, I give 100. So I can initiate the baby more than 35 weeks. I can give just only 21%. If the baby is than 35 weeks, I will start it with 21 to 30%. Unless the baby is require chest compression, I have to increase oxygen to 100%. So I have maniability or the variability to use the oxygen. I can use it 21 for more than 35 weeks. If I can use it 21 to 30 for less than 35 weeks, I can use it 100% if there is indication for chest compression. And the last one, to eliminate the variability associated with the bag ventilation. Eliminate all the variability associated with bag ventilation. What is this variability? Regarding the oxygenation, as I mentioned, the self-inflating bag, it will give you 40% oxygen unless you put the reservoir or oxygen reservoir, whatever, open or closed, to give you more than 90% or 100%. So it will eliminate this variable. The second issue is the pressure. It will be controllable, constant, persistent, distant pressure. So the other, you have to put manometer to monitor your pressure you give to the baby. So you will give benefit, but will harm the patient, and this will lead to what? Chronic lung disease and all of this. So the neopuff or the CPAP, it will prevent or decrease the incidence of chronic lung disease. So it will eliminate the variability of the bag ventilation by controlling the pressure, controlling whatever the PEEP to prevent the barotrauma, and also control the PEEP also. And can you adjust the PEEP? You can put it from 5 to 8. From 5 to 8, you have the range. So to keep the lung or the alveoli open to prevent the atelectatic trauma. This is the benefit from the neopuff. It will eliminate all of the variability associated with bag mass. So it can give CPAP. And they can limit or control the pressure, whatever the PEEP or the PEEP. So if you control or limit the pressure to prevent the barotrauma, if you control the PEEP or to prevent the atelectatic trauma and prevent the tearing injuries lead to the biotrauma and all of this. Also, it blended oxygen to prevent the oxygen toxicity. You know, the oxygen is medications, it's the drug. It can lead to free radical, oxidative injuries, oxidative stress. It will affect in the brain, lead to BVL, it can affect the eye, it leads to retinopathy prematurity, can affect lung, chronic lung disease. So it's blended oxygen with air, so you can adjust 21 or 30 or 100 if there is chest compression indicated. So it will prevent the oxygen toxicity, and also it will prevent also the ventilation associated injuries, barotrauma, volutrauma, and atelectatic trauma or biotrauma, even ryotrauma that is coming from the flow. And the beauty of the neopuff or the TBs also eliminate all the variability associated with the bag ventilation regarding the oxygenation and ventilation. ده بيسموه عمهم كلهم 3 in 1, 4 in 1, 5 in 1. You can say it whatever for the neopuff. It's 3 in 1, 2 in 1, 3 in 1, whatever. So هو ده عمهم كلهم، كله منه فيه 3 in 1 or 4 in 1. 1 2 3 4, so it's 4 in 1. It will give CPAP because some devices cannot give CPAP unless you give unless you put the PEEP valve. The pressure is limited because the other is not limited the pressure, whatever the PEEP or the PEEP, and also is blended oxygen, so it prevented the oxygen toxicity toxicity and eliminate all the variability of the bag ventilations. At the end, I would like to pray for my colleague going for Saudi board, Jordanian board, and Arab board, Egyptian board, and my colleague going for the neonatal fellowship. ومن أحياها فكأنما أحيا الناس جميعا.